The time people try to get in for their annual physicals before the end of the year, many expecting them to be free. But many times that is not the case, with people reporting surprise medical bills for services they thought were covered. Chris Harapsky looks into why this is happening and what you can do about it.
You mad?
I am mad. I am mad. And I'm mad in part too because nobody seems to be paying attention.
Last summer, Ann Summerfield went to Health Partners for an annual physical.
Doctor comes in, I'm going to say no more than 15 minutes with me. No more.
A typical exam, she says. Then the bill came.
Well, I couldn't breathe. I couldn't breathe. I am charged for 3 office visits. So a medical visit, a physical history visit, and a medical visit, to the tune of $1,067.
It seemed like a routine preventive health check, fully covered thanks to the Affordable Care Act. But behind the care curtain, the billing codes indicated treatment of 5 chronic disorders, 3 of which she doesn't have. The other 2, she says, the doctor didn't address.
I came in for a physical. I feel good. I feel fine. And you're telling me, the billing office is telling me I'm chronically ill. My doctor did not tell me I'm chronically ill.
In response, she filed a fraud complaint with her insurance and the Minnesota Attorney General's office, citing unwarranted charges.
Have you ever gone in for an annual physical?
Then we asked you, the viewers, if something similar has happened to you. We received enough stories to fill this newscast. Surprise bills, charges for questions the doctor asked, confusion over the point of a physical.
People don't want to seek health care because these bills are insane.
This woman, who wished to remain anonymous, said she was charged $113 for filling out an anxiety questionnaire and asking for a prescription refill during her physical.
I was perfectly healthy, no problems, no concerns, but that's part of my responsibility of taking care of myself, is making that annual exam. And now all of a sudden I'm getting a bill for something that I didn't even need to go, right? I would have never made an appointment to see a physician to get a refill.
We need a simpler system.
To help sort out this frustration, we turn to U of M health policy professor Dr. Jean Abraham, an expert in the Affordable Care Act.
This is probably one of the most challenging provisions in terms of how it was implemented and how we see it working today.
According to the language of the Affordable Care Act, here's what must be fully covered by most insurers. A list of about 40 services or screenings rated A or B by the U.S. Preventive Services Task Force. You can look these up. Examples are various cancer screenings, blood pressure and diabetes screening, STI testing, and many others. The law also covers CDC recommended vaccines and certain preventive services for women and children specifically. It does not say anywhere that all annual well checks are free for adults. In fact, according to one bill explanation from mHealth Fairview that we received, the clinic tells the patient during physicals they must charge a separate office visit for any concerns resulting in health recommendations, diagnostic lab tests to monitor any new or pre-existing conditions, new or refill prescriptions, referrals, or any testing or procedures during the visit. The clinic writes, quote, "This is a rule set by insurance companies that we must follow."
It's the only industry where you have a conversation with someone, you have no clue what you're buying.
There is definitely that. It's complex. Some of the research we have seen suggests that between 19 and 30% of preventive care services can induce an out-of-pocket cost. So this is a common problem.
We're working hard to make that less and less confusing all the time, but it is not a perfect system.
For the insurer's perspective, we talked with Dr. Mark Steffen, Chief Medical Officer for Blue Cross Blue Shield Minnesota.
If you could redesign it so that there were no surprises for the patient, how would you do that?
I think transparency is key. When you look at the number of medical codes that can be used in billing, there's a lot. I don't think people are out there trying to do gotchas, Chris. I think they're trying to deliver high quality care, and that's what we strive to do at Blue Cross.
His advice to patients: do not put off preventive care. It works for your health. Be an informed consumer who knows their plan. Third, ask questions to your doctor. If we discuss this, will I be charged? This advice also shared by Dr. Abraham.
If a doctor asks, is there anything else you want to add? What's going on?
I would probably ask, are you going to charge, am I going to get a charge for this if I tell you?
And that's where we're at right now.
It's not a healthy situation.
Both mHealth Fairview and Health Partners say the billing in the 2 cases that we cited in the beginning of the piece were accurate, and the patients still disagree. They're appealing. In a statement, Health Partners tells us, quote, "We work hard to make sure billing is clear and accurate for our patients. This includes educating our patients about the scope of preventive care visits and when additional charges could apply." And they're referring to sheets like this. You may recognize it. You probably can't see it really good on the camera, but it tells you what a preventive visit covers and the things that it doesn't cover.
And you'd find that where?
Well, they usually give them to you when you sit in the lobby before your appointment.
maybe
It
on
usually
the
comes with your
clipboard, like the
paperwork
paper-
on the clipboard.
Oh,
But it's
okay.
interesting because it says it covers screening for depression and high blood pressure, but it doesn't cover treatment for blood pressure or depression.
Wow.
So it's sometimes hard to follow.
I agree, and I never would have thought of asking that question. If I talk to you about this, am I going to get charged separately for something? You just kind of assume that the visit is the visit, and that's what you're charged for, is their time.
And this is what I'm telling you is not the case.
Yeah,
If you
that's
want to be
enlightening.
protective of your wallet, be open with your words and your doctor. They're there to treat you, but they also have to charge for the
Yep.
service. You need to be proactive in asking these questions.
That was super informative. I had no idea. All right, thank you, Chris.